Hello, everyone. My name is Melissa Olivares, and I am a sophomore here at New Mexico State University. Today, in my presentation, I will be talking about breastfeeding for infants. This presentation was done for my Family and Consumer Science class, FCS 210. It is known as Infancy and Early Childhood in the Family. Again, I am taking this course at New Mexico State University. Now let's get started. What is breastfeeding? Breastfeeding can be defined as the method of feeding a baby with milk directly from the mother's breast. Breastfeeding allows mothers to feed their children with the milk they have physically produced through their own body. Mothers may find a comfortable position where they are holding their baby in a safe hold and latch their mouth to their breast. Some common breastfeeding holds would be the clutch or football hold, because the way you hold your child would resemble the way you would hold a purse or a football. The cradle hold allows you to prop your baby's neck correctly with your arm, and the crossover hold allows you to do the same thing as the cradle hold, except you would use your opposite arm to hold the baby's neck. Some other ways that are easy for mothers to breastfeed would be with the help of a gliding chair or a rocking chair. This allows the mother to be more comfortable as well as create a smooth rhythm for their child. Some benefits of breastfeeding for the baby would be that the milk is easily digested. It has all the nutrients a baby needs and contains antibodies to help protect against infections. It is also noted that babies who are exclusively breastfed don't tend to be sick as often and have less doctor and hospital visits. Breastfeeding also helps protect infants from SIDS, which is also known as sudden infant death syndrome. Since mothers are constantly feeding their baby every 2 to 3 hours, it allows them to constantly be checking their child and being with them during feedings. It also can reduce the risk of certain diseases and infections. Gastrointestinal, ear, and lower respiratory infections as well, as allergies are reduced significantly if a baby is being breastfed. Also, if some children are born with jaundice or have asthma, it is said that breastfeeding can help also reduce those problems. Some benefits of breastfeeding for mothers would be that it is very economical and convenient. Mothers don't need to worry about making bottles, preparing formula, making sure it is the proper temperature, and have to clean all these items later. The milk that a mother produces is already at an acceptable temperature for the baby, and there aren't any other items used that will require cleaning or attention later on. It can also help mothers with weight loss. Breastfeeding can make mothers lose an extra 500 to 800 calories a day. Mothers who breastfeed are also encouraged to consume a healthy diet and consume more calories, since they are burning a large amount during feedings. During the first few weeks, mothers may experience some cramping like during a feeding session, and the reason why is because oxytocin is released during a feeding, and it helps the mother's uterus contract and return to its normal size. It also helps reduce the risk of diseases and cancers such as heart disease or breast and uterine and ovarian cancer. Also, a mother who breastfeeds could have her uterus return back to normal size within 6 weeks or the next prenatal appointment with their OBGYN. However, if a mother does not breastfeed, it can take longer, such as up to 10 weeks, for mothers to have their uterus go back to the normal size. Some benefits of breastfeeding for both the baby and the mother would be that it creates an intimate bond between a mother and child. It also helps families save money since breastfeeding is free and the purchase of bottles and formula isn't needed. However, if a mother does decide to purchase a breast pump, it could be a costly investment. However, there are different various types. Some breast pumps can run from about $30 to almost $400. However, thanks to new laws, mothers are able to get breast pumps at a much lower price, or they can get it free through their insurance. It is also better for the environment because you don't need to be using water to create the formula or purchase plastic bottles. Milk can also be provided for the baby anywhere at any time. As long as the mother and the baby are together, the mother will be able to provide food for her child, since mothers have a response of letting down milk whenever they think, smell, or hear about their child or any other baby. It is also said when a mother is away from their child for a long amount of time, they may also produce milk and release a letdown. When can a mother start breastfeeding? A mother can begin breastfeeding within the first hour after birth. More hospitals and birthing centers are recommending mothers to be with their child for about 90 minutes right after delivery to have skin-to-skin contact. This not only creates an emotional bond between a mother and her child, but it also helps mothers stimulate their milk production and help the baby meet a good body temperature. It is recommended for babies to be fed every 2 to 3 hours. Mothers can continue this pattern, especially if their child is sleepy after birth. This will guarantee that the baby is receiving all of its nutrients and is being properly hydrated. Mothers are also able to express the milk at different times if they feel they have an excess amount of milk or simply want to increase their milk supply. If mothers breastfeed continuously after birth, milk production will be stable due to supply and demand. As long as the baby is hungry and continues to be breastfed at around the same time, a mother's milk supply will continue to grow as much as the child may need during a feeding or sometimes more. Also, to keep track of how your child is doing, you can check their diapers to see how many of them are wet, and this will show how hydrated they are. Uh, from when they're first born to later on, it'll increase or decrease the amount of diapers a child will have. How long can a mother breastfeed for? A mother can breastfeed from the moment their child is born to several years. Not all women are the same, and some milk production may decrease at a certain time and others don't. Some mothers may want to breastfeed their child for up to a year, but sometimes their milk production just stops, and instead they have to use other resources such as solid foods or formula. Solid foods are recommended for babies to consume at 6 months, and breast milk can still be continued to be given until it is completely substituted for solids. During this time, mothers can check the diaper of the baby, and usually their stool will change once solid foods are introduced. However, if they are still being continued to be breastfed, their stool should look mustard-like, runny, and sometimes it may look like if there are seeds inside. This is completely normal. However, the stool does come out different, like pebbles. It could be a sign of constipation or dehydration, and this can mean a mother's not giving her child enough milk. However, if mothers decide to not introduce solids just yet, then breast milk will still be fine, since it has all the nutrients that their baby needs. How does a mother breastfeed? First of all, the mother must have clean hands to ensure there will be no germs passed on to the baby. And when the mother holds the baby, it will be in a comfortable position where the baby's neck is extended in order for him to have his jaw wide. The wider the baby's mouth is, the better grip he will have of the breast. This will allow for a good latch to be established, and the majority of the areola should be inside the child's mouth. If the areola isn't completely inside or the majority isn't inside the baby's mouth, then some milk will leak and it will create a big mess for both the mother and the child, and the child won't receive as much milk as he would like. Also, if there isn't a correct latch, this could lead to sore nipples or cracked nipples, and this could be very painful for the mother, and it could also create them to stop breastfeeding. However, if you grab your breast and slightly run your nipple over the baby's lip, it will help create a stimulation, and it will allow the baby to open his mouth. If running your nipple over the baby's lip does not work, you could also have it run over his nose, and he can smell the breast milk, and that could also create him to open his mouth. Once the baby has opened his mouth wide enough, you may push him towards the breast to establish a latch. However, if the latch isn't correctly done, in order to make it less uncomfortable for a mother, to separate the latch, they can put their finger inside the baby's mouth. That way you don't pull or tug on your nipple, and it could create more pain. So by putting your finger, it creates less pain and it creates an easy detachment from the baby. Some cues that breastfeeding is being done correctly would be that the majority of the nipple and areola will be covered by the baby's mouth. You can also hear and see your baby swallowing milk. The baby will remain on your breast until he is done eating. Once the baby is full, he will start to fall asleep on the breast or move away from the breast, signaling that he is done eating. You don't want to continue forcing your child to eat if he is done. He will show you that he is done the same way he shows you that he is hungry, by crying or putting his hands in his mouth or doing like little sucking motions with his lips. Those are all signs that he is hungry, and him moving away from your breast would mean that he is full. And if by overfeeding him, you can create a lot of spit up, throw up, and problems with him. So it's better to just leave him alone and let him tell you when he is done eating. Pinching and biting pains that most mothers feel will eventually subside. Breastfeeding can be painful at first, but with practice and constant feedings, the pain should eventually go away. If the pain doesn't go away after the first few days or weeks, it is recommended that mothers find a lactation consultant for help. Mothers shouldn't wait for the pain to last weeks. They should go immediately if the pain still hasn't gone away by the first week or two. If there is bleeding involved, blistering, or just so much pain that the mother is uncomfortable and the baby is uncomfortable as well and feedings aren't going correctly, it is important for the mother to find help right away. Not only do they need to find help just locally, but they can also call a hotline to get support from other people or online support groups. Breastfeeding should be a wonderful and easy task once you get the hang of it. And if it is uncomfortable and causing a lot of harm and pain towards the mother or child, then it should be stopped and fixed immediately. That way you can resume correctly without time running out and the baby not wanting to latch anymore. Some common problems with breastfeeding are sore nipples, and that can be the result of an improper latch or hold. Cracked nipples can be caused by the same issues as for sore nipples and excessive dry tissue. There are several creams that can help numb the nipple to make breastfeeding more comfortable, and they are also safe for the baby to consume before or after feedings. These creams can also be used before showering to help prevent the water from hurting your nipples if they're very sensitive. Blocked ducts are lumps under the skin that can feel sore when touched. They are usually the size of a pea, and they can be fixed by massages from your hand, warm heat from either a shower, a towel, or a heat pad. Also, feeding frequently can help fix blocked ducts. The baby sucking will eventually get all the milk that is stuck, and sometimes positioning them in a different way can also help get rid of these blocked ducts. Typically, blocked ducts are caused by skipped feedings, a tight bra or underwire in a bra, an oversupply of milk, or having a poor latch. All these can be fixed by continuing to feed your child at the correct times, by wearing a maternity bra, or just getting a bigger bra size, because usually you intend to increase the cup size during pregnancy and after giving birth. So these can be fixed. Also, having a poor latch, you definitely want to consult with a lactation consultant so they can help you fix this issue. Mastitis can be caused when blocked ducts aren't fixed, and they may lead to a breast infection. Women may also feel like they're getting a cold, and their breast may be red and sore. Sometimes streaks will go along the breast as well. And mastitis can be very painful for some women, and it can lead to them going to the hospital to get certain medications to help fix this problem. Mastitis can definitely be avoided, but sometimes just having so much milk can be a problem, and this is where a breast pump can come very handy. Mothers who exclusively breast pump, um, they are mothers who had difficulty getting their child to latch on, or may decide to feed their child with the help of a breast pump. Breast pumps come in various shapes and sizes, but they all have the same common goal, which is to extract milk from a mother's breast. Some breast pumps are manual, meaning you use your hand to help pump the milk, or there are electric pumps which make pumping easier and faster. It is recommended you also have a breast pump during your hospital stay, but if you don't, hospitals do have breast pumps that they can give you, and these are hospital grades, and they're very expensive, very big, but they also are very fast and efficient with getting rid of the breast milk. Depending on your feeding situation, there are different breast pumps that will help meet your needs. This helps mothers continue to feed their child breast milk despite not being able to physically breastfeed. Sometimes, if a mother's ill or has consumed alcohol or any medication that can affect a child, a breast pump can help extract this milk, and you can throw it away if it is unsafe for the baby to consume. However, if you know you're going to be away from your child for a long amount of time, you can also breast pump and keep the milk and store it for another time or feeding when you're not available, like if you're having a babysitter or you're just having someone else watch the child while you're at work or gone to the store. Some benefits of having a breast pump would be that it helps mothers express extra milk left in their breast. So sometimes after feeding, some children don't get all the breast milk that a mother may have, so the breast pump can do that for them, and mothers can save this milk that they collected and use it for another feeding at another time. It is advised for all breastfeeding mothers to own a breast pump to store milk in case they can't be with their child. It also helps working mothers collect milk for their child despite being away. Sometimes when mothers have to go back to work, they are given some time to pump milk and store it in a private room or area depending on the workplace. It also increases milk supply. For whatever reason, whether a mother was ill or they feel like they're not producing enough milk for their baby, pumping can help increase their supply if they do it constantly. It is also important to know how to store breast milk. You can't leave it out for too long, preferably no more than 4 to 6 hours. Also, you want to keep it in the fridge for no more than a couple of days. Usually a week would be too long, but if you do put it in a deep freezer, the milk can be good for up to 6 to 12 months. Why do mothers quit breastfeeding? Mothers can't bear the pain breastfeeding causes. Some mothers may experience blisters, hickeys, or bleeding during breastfeeding, and it can make the experience very painful and traumatic, causing mothers to quit. Some mothers return to work, and it can get difficult to produce or collect milk when being away from their baby. Mothers get ill or can't produce enough milk, causing them to use other sources to help their child get all the nutrients they may need. Mothers don't have enough support. It can be extremely difficult for mothers to breastfeed when they're in pain or in public and being shamed for feeding their child. Having a good support system or being a part of a breastfeeding group can help mothers feel protected, safe, and not alone. How to get fathers involved. Some fathers may feel left out during the feeding process of their child. Pumping can give fathers the opportunity to feed their child while still providing their baby breast milk. There are multiple milk bottles that are similar to a mother's nipple, so they do not get confused with a breast and a bottle. Some bottles also help prevent colic and can control the flow of the milk, so it is important for parents to be aware of which bottle offers the most benefits and meets their needs. Resources for breastfeeding. Lactation consultants help mothers be successful in breastfeeding, and they help identify any incorrect forms during a nursing session. Breastfeeding classes can be offered by healthcare providers' offices or the hospital that a mother plans on delivering in. Breastfeeding support groups also help provide tips on breastfeeding and offer encouragement to others. It is important for mothers to reach out for help if they need it, because breastfeeding is supposed to be relaxing instead of painful. The faster that the mother reaches out for help or tips, the faster she can feel better and resume providing nourishment for her child. These are the references I used throughout my presentation, and I hope you all enjoyed. Thank you for watching.